branch, New South Wales Nurses Association, and I'm here today speaking on behalf of concerned Moruya staff and community and other peers, because we're rallying here today for an increase of one nurse to 3 patients in the emergency department. We also want a delegated triage nurse, just like Bateman's Bay, on every shift. One nurse to 3 patients. It's unsafe. We feel stressed, and we care about the community and the standards. We want to keep up with the standards. We want to surpass those standards. We need the support of the community, of the Chief Executive in our resolution that we've put forward through the New South Wales Nurses Association and Midwives for an improved immediate staffing here at Moruya Hospital Emergency Department of 1 nurse to 3 patients with a designated triage.
Per shift. Every shift.
Each and every shift. We're here today because we're stressed. We have concerns regarding patient care and safety, and we are dissatisfied with the current staffing levels at the emergency department here at Moruya. Okay, so what do we want? It's quite simple. We want 1 in 3, ratios of 1 to 3 in the emergency department. We want a designated triage nurse, very important. And extra nurse on each shift. Why do we need a designated triage? Well, why don't we have one? Bateman's Bay have one. Why are we any different? Are we, smaller, have less people coming to the area? No, we have acute people coming to this area. We should be we should be on par with, at least with Bateman's Bay. We're working in isolation here at Moruya in triage. Both nurses could be out the front. If you enter our hospital via the waiting room, it wouldn't be that unusual for you to fill in a clipboard instead of seeing the triage nurse, and it's just not good enough. You should be able to see the nurse when you enter the department, not the clerk, not the clipboard, but a designated triage nurse. As I said, equal to Bateman's Bay. Our layout and design make it even more unsafe here at Moruya with the way the department's designed. Why are we so busy here at Moruya? Look, we've got the ageing population that we know, we've got growing families, we've got tourists coming to this beautiful area, and that's only increasing. People moving to the area because of our lovely, where we live with nature and water, and take a look around.
We have to see tea.
Yeah, well, this is true. Currently, so let's just look at what we currently have. We have 2 nurses on a day shift, 2 nurses on the evening shift, 1 nurse on a night shift. Not good enough.
How do you do a resus with 1 nurse?
Yeah, I'm not counting the D shift in this because we only have them 4 days a week, maybe 6 hours a day once they cover meal breaks, and they could be redeployed. Who knows, what can happen in the course of a day. We're not counting that. So we have 2 in the morning, 2 on the evening, and 1 on a night shift currently. We need better. It's not safe for patients and for staff. We want to give good quality care. We can't expect 1 nurse to be caring for up to 8 to 12 acute patients.
No.
This is unfair.
Risky, dangerous.
At times we have patients, acute patients, up to 6 to 8 beds in the ED. This is counting the lounge chairs that are now in the department as well.
And spare chairs.
And we could also have a patient in the consult room. Up to 9 patients, acute patients, plus that's not counting a waiting room. That's not counting patients that may be on chairs in the acute area. We can't do this with 1 nurse to all those patients.
What about the
We've got
181 ambulances that arrive each month?
We've got ambulance that are arriving each month. So we've got the CT scanner here at Moruya, so we're getting more patients because of that. We're getting acute patients, we're getting transfers from Bateman's Bay Hospital for reviews, and they're sitting in our department awaiting review either by a surgeon and also medical reviews. We've had acute patients transferred from Bateman's Bay. Not saying that that shouldn't happen, but we therefore need to be staffed appropriately so that we can care for these extra patients on top of our already the workload of patients coming in on a normal emergency day. We shouldn't be called to cover meal breaks throughout the hospital and leaving one nurse to the whole department front and back in the emergency department. I think we've all had enough, and we all know that that's dangerous. We need 1 to 3 in our ED. Over the past 5 years, our acute presentations, that is category 2 patients, these means they're very unwell, has more than tripled. Our triage 1s have doubled. This means people are sicker, this means people are more acutely ill, this means that people need more intensive nurse labouring. It's nursing intensive to treat these patients. We need staffing. We want to be able to do it properly.
Safe staffing.
We want safe staffing. We're busier than ever before. It might not be reflected in data, but as I said, we're getting transfers from out of area. We're getting CTs happening on a weekend that are outpatient CTs, adding to the workload. Surgical patients for review. Patients are bypassing other hospitals because they know we have a scanner here at Moruya, and they have a perception out there. We won't go to Batemans Bay. Moruya has a scanner and pathology will just go straight there.
True, true.
Yep. And you know, I've had patients say this to me, and I think I can speak that, you know, in the community this is what's happening. We want to desperately deliver quality, safe care in our Moruya emergency department. And we need the Chief Executive to answer our request as per the New South Wales Nurses Association and our branch.
Andrew Newton, we want more nurses.
Please listen to us. We want to meet peer benchmark standards, but the ED needs to be staffed adequately for us to be able to do that. So we want to surpass standards if we could, but we need to be staffed.
Absolutely.
I think I can speak for most nurses when I say this, and you can quote me. The most satisfying part of our job is when we get to do it properly.
Yes.
And what's the most dissatisfying part of our job? When we can't do it properly.
So
And we
true,
can't
Mary.
do it properly because we're not staffed safely, and we're not staffed to the ratios, safe ratios of 1 to 3, and as designated triage nurse for our Moruya Hospital. I'd like to acknowledge that Dr. Holland and Dr. Kirsty Dunn for their support, and I'd also like to acknowledge that locally our managers, to the extent that they're able to, have been supportive of us, but we're going beyond them because their hands are tied as far as we've been told through our workloads committee. We're not getting more staffing, so we need this movement to carry forward because we want 1 to 3 in ED and we want a designated triage.
When do we want it?
Now!
What do we want?
1 to 3!
When do we want it?
Now!
What do we want?
1 to 3!